So the NHS long-term plan has described a very clear ambition to develop primary care networks across England. And I'm delighted to say that we've made fantastic progress. So 99% of practices since the 1st of July are now a part of primary care networks in England. But of course, that's just the first step. So that really means that what we've got is practices interested, practices willing to participate in this really significant transformative program. But importantly, it's a journey. And we need to recognise that we need to be looking across the next 3 to 4 years as those practices start to develop relationships, start to create leadership, start to form networks that go beyond the bounds of general practice with other providers in the community, and start to develop their workforce, thinking very differently about the kinds of healthcare professionals who will be able to support people outside of the hospital environment. So critical to enabling the transformation of services in the community is going to be the ability to release time for clinicians in particular to provide leadership and support the development of new organisations. You know, if you were trying to think about this from the perspective of any other startup, you'd be thinking, what are the first steps? How do we ensure that these new emergent networks of care create a shared mission, a shared set of values? How do we start to develop a genuinely future-looking, well-resourced and ambitious and innovative environment going forwards? So from my perspective, I think it's really critical in the first instance that we try to provide the resource to support these emergent primary care networks as they take their first steps. Now, a lot of that is going to be about funding, and one of the things that I think is incredibly important in the long-term plan is that there is a significant amount of funding going into general practice to support this. So £4.5 billion to support the development of new primary care networks across the country. But what is critical is then to recognise the variations in level of maturity that exist across the country, and to think about how we ensure that that funding can reflect local need. So rather than try to necessarily prescribe a developmental model, think about how we can essentially support and enable that development on the ground and help primary care networks describe what it is that they need to become really sustainable and, as I say, vibrant new organisations going forward.